Dr. Martinez, you're talking a lot and you're putting a lot of emphasis on preventive dental care and on, personal hygiene and just like personal involvement in terms of making sure your teeth are the way they are and should be, and all that, as you should, as every doctor should. And with no doubt that, doctors are there to be preventive. That's the old doctor's take at the beginning. And I know many patients, they think that a doctor rather has somebody coming in with 15 implants and spend 30 grand or whatever it may be that something like that costs, and wipes his hands, and that's really not true, and it's definitely not true with you. What I have noticed, most doctors really rather have 100 people coming in spending a little money than 10 people coming in spending a lots of money, and I'm sure you fall into that category. I know you are. Are you?
Definitely. I enjoy seeing patients when they take care of their mouth, and they have always taken care of their mouth, and they come in because they want that maintenance done on their teeth, and they love that cleaning, and they want to have continued care.
So let me share. Go ahead.
Sure.
Go ahead.
I just
Continue.
feel that when people come from that, they appreciate what you do, and they understand what you're trying to tell them about their health. And they don't take it personally if you tell them you're not brushing properly. And I feel that that's really, really important. Don't get me wrong. I don't mind the patients that have had that have a lot of problems and have issues. And that it's not really necessarily an economical thing. Yes, of course, we are here to treat patients and to do. It's a business, whether we like it or not. But I do like to see those patients as well, because I like to know that I can help them.
You like to steer the way I have read you. You like to then steer them on a different road. It's no different than a kid who doesn't want to study. Mom tries to every day to try to say, come on, you got to study it maybe a little bit more. No, you don't need to become the next Einstein. But by the way, Einstein was not exactly a genius. He was no Einstein in school, apparently. But
just a reputation, huh?
Yeah, but the point is, you try to steer them into what you as a professional know is the right direction, and that's very important. So it wouldn't matter at what stage and with which type of discipline in personal oral health or otherwise, people come to you. That's where you try to get them. But that said, now, let's go to the cleaning thing. Why is it that some people, most of the time, 6 months cleaning seems to be the norm. At the same time, there are some people out there that don't go for a year, and really it's just fine. They have very little plaque build up, and they brush good, and it's totally fine. At the same token, there are some people, the dentist keeps telling them, you gotta go every 2 months or whatever it might be, 3 months, 2 months, 4 months. For instance, my dentist tells me 2 to 3 months. Well, I frankly barely ever make it, and if I make it in the normal 6 months, I'm quite happy. But he do tell me that I'm supposed to. And one of the reasons he says is I think he doesn't tell me that I probably don't brush and floss as good, because my wife spends 10 times as much time on it than I do, so I know I must be. A, she's way overdoing it, or I'm way underdoing it. It's one of the other. But he also tells me I have a tremendous amount of saliva, which he calls a good thing, but a little bit of a side effect of building up more plaque, and which why he says I need to come more often. Can you shed some light on that thing, and so that you can explain people and that they don't think that it's the dentist who just wants to make more money, so he wants to make him coming more often. Or maybe it is that way. I don't know. I doubt it.
No, I don't. It's not really the reason. I mean, there are some people, and you were right about saying that most people, I would say about 70% of the population or in our patients are okay coming in every 6 months. But there are that segment of the population of our patients that cannot afford to go every 6 months, that cannot, and not financially, I'm talking about their teeth, that actually need to be seen every 3 months or every 4 months. And that's because once we are seeing a patient, we can actually tell if this patient is doing a good job of taking care of their teeth throughout the appointment, in between appointments. Also, we can tell if there's bleeding or a lot of accumulation. There are some people that are just people that accumulate a lot of tartar, a lot of plaque. And there are some people that just don't take care of it. So we make that determination, and when we see that a patient is going 6 months, and when they come in, there's a lot of bleeding, there's a lot of inflammation, there's borderline gum disease, periodontitis, then we make that determination together with the patient where, it's going to be a lot more economical in the long run for you to come 4 times a year for regular cleanings versus coming, the next time you come in, you're going to need a deep cleaning, or we're going to have to do, possibly surgery for the gums. So it really is dependent on how we see the patient is evolving, how they take care of their teeth in between appointments. Now, I have patients that tell me, Dr. Martinez, I brush and I floss and I do this and I do that, and I still, I let them know that they have a lot of buildup. And so maybe those are the patients that need to come in every 3 months, because no matter what they do, they're just plaque builders and stain and bacteria. Now, there's a lot of people also that know that they're really not doing what they're supposed to do. They're not flossing, they're not brushing on a regular basis. And so they know that, they need the extra help, and coming every 6 months is probably not the best thing for them. Mm-hmm. So it's not a business for most. I would say for me it isn't, where I want to see them every 3 months to make sure that I get their money for every 3 months. It's because I really care about their gum condition, and I know that if we can place them on a very strict recall, we can maintain or contain that gum disease to the best of our ability.
Right. Now, when a person needs what you call a deep cleaning, deep scale cleaning, I guess it's also called and stuff, basically that means you're digging under the gums a little more. Usually the person needs an injection for that. Otherwise, it's kind of starting to hurt. And obviously it costs more. And that's one thing. And that's as we have talked once with periodontal disease, once you lose your teeth, which is obviously a bad thing for many reasons, but it's the time while you lose your teeth where you have an infection. So if you let your built up go under the gum and you have those bacteria stay for that period of time, 3 to 5 months, too much because it built up so fast. Basically, does that basically mean you have some slight infection going on, which is why you have to dig in so deep, and that infection already, no matter what, did cause the immune system to somehow go down, poison the body slowly, not like, fast, just like, nice and slow, but nevertheless drain it. Would that be a true statement?
It is, but the reality of it is I find that people that have or are borderline or have borderline gum disease or actually full-blown gum disease, it's actually have been a lack of care for a very long time. It usually doesn't happen from 6 months ago I saw them, they were nice and healthy, and then 6 months later they have full-blown gum disease or starting to get gum disease. Usually these people will be predisposed to having gum disease, and then not taking care of things will obviously make things worse. So gum disease I find that gum disease is probably the most common disease in the mouth. I would say that 9 out of 10 people have some sort of gum disease. It doesn't necessarily have to be full-blown, what we think of gum disease as, the teeth splaining and falling out. I mean, there's a beginning and an end to everything. And gum disease, just like anything else, has a beginning. And that is just when the bone starts being affected by all this bacteria. In the process of our body trying to fight off the bacteria, it starts deteriorating itself. Just like any other organ, and people that smoke or people that drink, their liver starts fighting off the toxins, and in the process it deteriorates itself the same way with the gums. The bone starts eating away on itself because it doesn't like being next to the bacteria. And usually it takes a while for it to start happening. I always tell people, one of the bad things about gum disease is that it doesn't hurt for the most part. It's very rare that you're going to have any symptoms of pain to gum disease. And unfortunately, that's when we run to the dentist or the doctor or anywhere when we're feeling pain. So because they don't feel any pain, they leave it, they linger, it keeps going, time keeps going by, and then they just, until something starts hurting. And usually it takes years for it to start hurting. So I always tell people that if they started feeling any symptoms, that they were lucky, like in the early stages, that they were very, very lucky to feel anything. because this way it made them come into the dentist and maybe salvage their teeth and salvage their mouth by doing deep cleanings.
Mm-hmm. Okay.
Unfortunately, most people don't go to the dentist every 6 months. They don't take care of, they don't brush and floss, and so when they come in, again, they have some sort of gum disease, and usually needing deep cleaning appointments.
Okay. All right. And so if a person needs a deep cleaning, if that's all he needed at that moment, and if it wasn't going on for too long that he kind of reached that stage, then all is not lost yet, is what you say.
Right. There's usually hope. I mean, the one good thing, if there is such a good thing about gum disease, that it's a very slow progressing disease. I mean, it usually takes months to years before it reaches from the beginning to the end stages where people start losing their teeth. The only time I've seen it progress from 6 months to the next where they're going to lose teeth is when they have either diabetes that's not under control, or they are pregnant women where it's a hormonal imbalance throughout the pregnancy, and that's when they end up losing teeth. But they've already had a predisposed condition of gum disease. It just became exacerbated during the pregnancy or during diabetes or uncontrolled diabetes episode. So
right.
It's just very, very important. I mean, regular cleanings, and if you haven't had regular cleanings, a good checkup, and if you need a good deep cleaning appointment, get that done, and then get stabilized. And usually a deep cleaning appointment usually takes care of things. We show you how to brush, how to floss, how to take care of things for yourself. And then that we determine what recall system we're going to put you on, whether it's 3 months, every 4 months, every 6 months, depending on how we see that you're healing and how you're taking care of things.
Thank you very much, Dr. Martinez.
Thank you.